Now, the phototherapy. It is a type of light therapy used to reduce the bilirubin level in the baby or body. It converts into water soluble and excrete out from body. Phototherapy involves shining lights both below and above the body, and the lights dissolve in fat in the body. Two beings dissolve in water and therefore is excrete in the urine. The UV rays of wavelength is 460 to 490 nanometer are used, and the power of light is 30 micrometer per centimeter square per nanometer. Now, the phototherapy in patients to wear protective eyewear and cover genitalia because UV rays can damage eyes and genitalia, and it can cause dehydration in the baby. Now, the range of bilirubin level. Normal bilirubin level is 0.1 to 1.2 mg per deciliter. For direct, the bilirubin level is less than 0.3 mg per deciliter. For indirect, bilirubin level less than 1.0 mg per deciliter. Now, the indications of phototherapy. If the baby is having neonatal jaundice, so after that we can provide the phototherapy. Now, the contraindications are skin disease, hepatic dysfunction, or skin cancers also. And these factors, if the baby is having premature low birth weight, malnutrition, and G6PD deficiency, means glucose 6 phosphodehydrogenase deficiency. So these are the risk factor of phototherapy. Now, the benefits of phototherapy is faster bilirubin reduction, reduced treatment time, and improved safety. And complications is hyperthermia, retinal damage, bronze bony syndrome, dehydration, hyperpigmentation, and hypopigmentation.